Hey everybody, how's everybody doing? Happy Webinar Wednesday. It is time for another.
So you ain't gonna introduce me?
I just started.
Oh, you're right.
It's time for another webinar. You like my new backdrop? That's my IT guy doing his thing. Right? Can't really see it all the way, but it's really, really nice. Oh, there you go. See? Tysons, oh, maybe we should keep it there.
Okay, we'll keep it right there.
Yay, okay. So that's my new backdrop. We're in my IT guy / nephew / co-host in his new home. So excited for him and my niece. So we are going to get started. How's everybody doing? Did you have a good week? As you see, I sound like a frog / Carol Channing. If you don't know who that is, look it up. That's what I sound like.
Wow.
Focus. So let's get started. We are talking about penis and prostate health. So I was ready for this topic. I know a lot of you were ready for this topic. My nephew, he's probably going to be a lot because of the topic, but that's okay because we're going to stay focused. We're going to get into it and we're going to talk about it because it needs to be talked about. It's important. So as we bring June to a close, I wanted to make sure that we end the month supporting the health of our men. June 14th through 20th was Men's Health Week, and I thought the discussion about penis and prostate health would be an exciting topic to further show our support. So why not talk about it? Because it's not talked about very often. You don't really see it on TV shows. You don't see it there are books and things like that and articles, but even in doctors' offices, men aren't really talking about this topic. So I think it was worth discussing because it's pretty important. So penis health is an important part of men's health, and it goes beyond your ability to get and keep an erection, ejaculate, and reproduce. It goes beyond that. It's so much more than that, and you'll see as we get into it. So penis problems, they can be a sign of an underlying health condition. Ongoing health issues affecting your penis can also impact other areas of your life, causing stress, relationship problems, or poor self-confidence. Because of its function, your prostate is equally, if not more, important, and maintaining its health is crucial. Okay? So
we're getting to the slides.
All right.
Hold on now.
Who would think by now?
You're a judger.
Y'all help me welcome my co-host, Torrance Simmons.
Hey, y'all.
This is my co-host. Can we have the next slide?
Okay.
So as he's looking for the slide, we're gonna start talking about the next slide. Who is our target and why? So you see these handsome young men on your screen and mine. This is our target, all right? And we want to talk about Black men in general, really, but the community focuses on Black men, Black and brown men. And they're our target because, not just because they have penises and prostates, men are tough to get through to in healthcare, mentally and emotionally. You can't always break through men. This could be because of their macho attitude, fear of diagnosis, or being uncomfortable with exams. But whatever the case, there's an urgency to meet men where they are in their health and build from there. The Prostate Cancer Foundation estimates that African American men are about 1.6 times more likely than all other men diagnosed with low-risk prostate cancer experience progression, and twice as likely to die from it. Let me say it again because I messed it up. African American men are about 1.6 times more likely than all other men to get prostate cancer and twice as likely to die from it. 59.9% of African American men diagnosed with low-risk prostate cancer experience progression of the disease compared to 48.3% of white men. The reason is unclear, but it's likely linked to inherited genetic factors. So, as you can see, a little more reasons why we're doing what we're doing. Sexual health is essential. Penis health goes beyond your ability to get and keep an erection. We've already talked about that. And ongoing health issues affecting your penis can impact other areas of your life, and we've already said that. So before we move even more into it, you guys know how I am. I like to break things down. I like you to have a visual, so as we go through the slides, you can kind of in your mind's eye stay with me when I talk about certain things in certain parts, okay? So, anatomy of a penis, or schlong, or Wood, Johnson, whatever, what else y'all call it?
Old school tallywhacker. Meat.
Meat. Okay, just plain old meat.
I heard old meat.
Heard that before. All right. So let's get into the parts and the function of your guy. All right. So these are the main ones. Did I add? It's okay. The main ones are the corpora cavernosum, the corpus spongiosum, the vas deferens, the testicles, and the seminal vesicles. So for the purposes of time and everything like that, I'm not going to get into really deep into a whole lot of pathophysiological things, like meaning what the.
I was about to say, what?
I'm not going to get into a whole lot of the mechanics of things. For the purpose of this webinar, we want to stay on the focus of prevention and awareness and things like that. But as I said, I like you guys to have a visual so you can have a foundation of what I'll be talking about going forward. Okay, so prostate also is on there. I forgot to add it, but prostate is also part of the whole system that we're talking about, okay? So this is a visual, all right? So kind of a side view of what's going on with a man. Men are the only one that have prostates, okay? So this is where we are. So let's talk about these parts, okay? So the corpus cavernosum, if you can see that, the picture's kind of grainy, but if you can see the corpus cavernosum, it's the tube-like, the cylinder chambers that have a maze of tissue, blood, vessels, and open pockets. This is what expands when you have an erection. So this is the part that holds 90% of the blood once you have an erection. The corpus spongiosum, that is right on the underside of the penis, that prevents the compression of the urethra during an erection. So you see where the urethra is, it's the tube that's in between the corpus cavernosum and the corpus spongiosum. So that's where you pee. Okay? Now up away from that toward the testicles in the back, that's in between, that's the corpus cavernosum. That's the vas deferens, okay? And what that does, it squeezes sperm from the testes towards the back of the urethra, I'm sorry. So you see where the vas deferens is, and what that does is squeezes the sperm from the testes here towards the back of the urethra. So toward this part, okay? The testicles, they're responsible for producing sperm and making testosterone. Okay, so that's where men feel like, they're a man. Testicles responsible for that. The seminal vesicles, follow me, that's on the back side of the bladder. What they do is produce and store fluid that will eventually become semen. Okay, so the fluid that's produced there is very important for the proper functioning and survival of sperm. And prostate, that's the one that I did not have on the slide earlier, but you can see where it sits right below the bladder. What it does, it produces fluid that nourishes and transports sperm. And we'll get more into the prostate a little later, but I wanted you to see what makes your boy work what's happening. All right. That's what I wanted you to get a visual of. Next slide. All right, a happy penis equals a healthy bromance. So I know y'all, men, you like to make sure everything good down there. You know, you want to make sure your boy is good, he's healthy, ain't nothing on him. But I want to get into what makes him normal. What are you looking for when you're looking for a healthy guy? Okay. So, is my guy normal? Usually, these are just normal things. It doesn't mean, if you're not here that you're abnormal. Sort of like the webinar last month when I talked about vagina health. Everybody's vagina is different, just like penises. Everybody's penis is different, but we're going to talk about the abnormalities that you need to look for, okay? This is normal. 5 to 7 inches erect is normal. The girth is around 4 inches. Color is usually the same as the skin. Sometimes it can be a little lighter or a little darker. Texture is not usually smooth. 50% have harmless hair follicles on the shaft, much like tiny bumps, all normal. Foreskin, that's if you're uncircumcised. 30 to 32% of men are uncircumcised in the U.S., and that's okay. Sometimes we make it seem like if you're uncircumcised, you're just some type of outcast or something, but it's okay if you're not. Okay. Semen should be white or have a yellowish tint. It could be thick or thin, and it varies by the level of arousal, food, or the last time of your ejaculation. Okay. Now, go back. While we're talking about normals, let's talk about an erection and what happens and how do you know that you're having a healthy, normal erection, okay? So an erection starts in your brain. So that so if you've seen a video, Pornhub, whatever, no judgment, just whatever y'all do, or you can smell your wife. Why are you looking at me like this?
Because I'm waiting on you to finish listing off.
Oh, you can smell your wife walking by or think about your last sexual encounter. Those things make your nerves send chemical messages to the blood vessels in your penis. Now stay with me. I want you to get a visual. The arteries relax and open up to let more blood flow in. At the same time, the veins close up. Once blood is in the penis, the pressure traps it in the corpora cavernosa. Remember, that's the spongy areas. And then your penis expands and holds the erection. When you're aroused, tubes called the vas deferens, we talked about that, squeeze sperm from the testes toward the back of the urethra. We talked about that already. Then the urethra senses the sperm and fluid mixture. At the height of sexual excitement, it sends signals to your spinal cord, which in turn sends signals to the muscles at the base of your penis. These contract powerfully and quickly every 0.8 seconds. This forces the semen out of the penis as you climax. Now, what's the point of talking about this? Because this is not a sexual show. It is not a webinar where we're talking about anything like that. But I want to talk about what's normal. And it's important to know what is normal, okay? What I describe is a normal erection, all right? So let's move on. Penis anxiety and mental health.
Uh-oh.
This is a big one, okay? Because studies have shown that 85% of women are happy with the size of their partner's penis, while only 45% of men are happy with their own size. What's up with that? Do better.
Because Pornhub and all them.
So, guys, lighten up. Most of us, 85% of us, are cool with this. We're cool with your size. It's you that had the issue, okay? Most men are self-conscious about their penis and they shouldn't be. It's okay. But society has always placed great importance on the size of the penis. Many cultures associate penis size with masculinity. Throughout the ages, it has come to symbolize qualities such as virility, fertility, strength, ability, and courage. Okay? So feeling inadequate can really damage a man's self-confidence. And I really want to focus on this because a lot of men feel this way. And because it's not really talked about or discussed, you don't bring it up to anybody, to your doctors, your friends, your loved ones, your bros. You don't tell anybody. You guys just kind of hold it in, which is not good. So a lot of men experience shame, embarrassment, and anxiety. What is recommended that you seek counseling and see a psychotherapist. They can really help. It has been proven to be beneficial to men with penis anxiety. Yes, that's a thing. It really is a thing. Therapy helps patients identify and correct any distorted views about their penis, build self-confidence, and overcome fears about sexual relationships. I wanted to focus on that just a little bit because, a couple of months ago, we talked about mental health of men. And that is one of the aspects of it. So I just wanted to focus on that just a little bit. Okay. So let's talk about a little bit about erectile dysfunction. So many men go through this. Oh my gosh. So many. And it's very normal. Well, it's not normal, but it's common. That's what I should say. Many men go through it. So he won't work. What do I do? The inability to get and keep an erection firm enough for sex is what erectile dysfunction is. It can also be a sign of an underlying health condition that needs treatment and a risk factor for heart disease. It can also be accompanied by decreased sexual desire and libido. Okay. What are some causes that would make that happen? Heart disease, clogged blood vessels, high cholesterol, high blood pressure, diabetes, tobacco abuse, obesity, and certain meds. And you remember your arteries and veins and stuff, that's what's in your penis. So if you're not getting good blood flow anywhere else, you're probably not going to get good blood flow there. It doesn't work independently. So that kind of is a precursor to how the rest of your body is functioning. Complications of erectile dysfunction, things that could, complicate it, stress, anxiety. If you're already anxious about it, it can make it worse. Unsatisfactory sex life, embarrassment, low self-esteem, and relationship problems. Low fertility, too, can also be a complication of it. So let's talk about how we can help your guy out. If you are going through erectile dysfunction and you're having problems, what can we do to help your guy out? Treatment. There are oral medications, self-injections, urethral suppositories, testosterone replacement, penis pumps, penile, implants. That sounds a little drastic, but those are things that can help if it gets so severe that your blood vessels in your penis don't respond to their other options. So that is something that you can think about. And please know that erectile dysfunction can be helped. You don't have to suffer. It can be helped and it can be reversed in many, many cases. Okay, so nothing to be discouraged about. Just remember to talk to your doctor if you're going through some of those things. Okay. Prevention. So what can you do to you can't ensure, because a lot of erectile dysfunction issues comes with age. But what can you do in the interim to kind of make sure as much as you can not to have this happen? So you want to make sure you work with your doctor to manage diabetes, heart disease, or any other chronic health conditions. You want to see your doctor for regular checkups. Man, y'all not good with that.
I go every year.
I went a hit dog.
No,
stop.
No, the last time we ain't gonna talk about it right now. But I'm just saying, I go.
Stop smoking, limit or avoid alcohol, and don't use illegal drugs. Make sure you're exercising regularly. take steps to reduce stress. That's something that a lot of us, men and women, don't focus enough on, making sure that we have outlets and ways to reduce stress. Get help for your anxiety, depression, or other mental health concerns. That really, really does play a part in the level and severity of your erectile dysfunction. Okay. Now let's talk about the other guy, the other important guy, the prostate gland. You know what we're gonna talk about?
I don't know. I got a bad story about that.
Oh yeah. Y'all already got a feel violated, y'all.
I got violated, not feel. That's what happened.
We got to that part yet.
Okay.
So we go talk about the prostate gland, okay, because that is another important organ that we're going to talk about. As you can see here on the
we actually got a question. Hold on.
Yes. Oh my gosh.
So first there was a comment. Doctor, best diet plays a role in it. And then what doctor should the person see if they want to address penis health concerns? So which doctor is
urologist?
Urologist.
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 That's right. That's who you want to see. And usually they are consulted out. So your primary care physician will be the one to say, hey, or you could talk to your primary care physician and say, hey, I'm having these issues. I really, want to look further into it. He'll refer you to a urologist. Okay. Sometimes your primary care physician can help you if it's, mild, something that you guys can get through without being consulted out. But sometimes you have to see a urologist. Okay. So that was it.
Yep.
Okay. So let's move on. So you can see here where the prostate sits. It's the highlighted area. It's usually small, walnut-sized gland that sits directly below the bladder and plays a role in producing and fine-tuning semen. We've already talked a little bit about that. And here's a cross-section on the other picture of how the prostate kind of encapsulates the urethra. So the tube going down is the urethra. The organ around it is the prostate gland. And that's just a picture. The other one is just a picture of an enlarged one, and we'll talk about that. So I just wanted you to see what happens, and why it's there, where it sits, where it's located. Okay. Before we move on, I'm sorry. I want to talk about the functions, a little bit of the functions of the prostate, other than what I told you earlier. The prostate contracts during ejaculation. It closes the opening between the bladder and the urethra. This is why in normal situations, it is impossible to urinate and ejaculate at the same time. Did you know that?
I didn't know that.
Right? That is so interesting. So what it makes me think about, of course, is, and I'm not overly religious. I do believe in God heavily, but with medicine, you cannot help but know how awesomely made we are, because he thought of everything. So the fact that the prostate contracts during ejaculations just to make sure that you're not urinating and having an orgasm at the same time, that is awesome to me anyway. Also, the prostate make sure that the semen has the correct consistency and all the vital components that it needs to survive the journey towards an egg. All of this is essential for reproduction, so you want to make sure that happens. Also, the prostate needs male hormones like testosterone to function correctly, so that's important as well. Okay, so let's talk about disorders that are common to our community. So we'll talk a little bit about prostate, benign prostatic enlargement. Actually, they put a different name here, but it's benign prostatic hyperplasia. That's what the H is for. And we'll also talk a little bit about prostate cancer. And as I said earlier, we're not really going to get into the real deep meat of these disorders because we're not really talking about that. for the sake of time and just to make sure we continue to focus on what we're here for. And what we're here for is to focus on the support of our men and their health. So screening, prevention, things like that, that will help them in the promotion of that, okay? So I just wanted to put that disclaimer out because I don't want people to be like, well, we didn't talk about it. What is it? So we really won't be getting too much into it, okay? BPH, benign prostate hyperplasia, all it means is an enlarged prostate. And if you remember the slide that had just, the previous slide, the prostate is enlarged around the urethra. So that causes a lot of urine flow problems. And it's important to know that that BPH is not a precursor or risk for prostate cancer. That is a fact. So it is, if you have BPH, it does not mean at all that that's a precursor for prostate cancer. It is very common. Half of all men between 51 and 60 have BPH. Up to 90% of men over age 80 have it. So it's it's kind of an age thing. So your prostate is enlarging throughout your life. Just depends on the person if that prostate becomes a problem or not. Most times it becomes enlarged and you do have some urine flow problems, but not enough to, ruin your life. The urinary stream may be weak, stop, or start, and in some cases it can lead to infection, bladder stones, and reduced kidney function. And that is because, as we saw, when that prostate gets enlarged, it squeezes on the urethra, so you can't get that urine flow the way you would like because it's squeezing and compressing on the urethra.
Can we reduce it? Can we put ice on it or something? No? Okay. I was trying, guys.
Okay, so signs and symptoms of BPH. You know what? I'm a beat. You're right. That's a legit question. You cannot put ice on your prostate to reduce the swelling because it's not true swelling, it's enlargement. There's a difference. Signs and symptoms of BPH. So we talked about earlier.
Shots fired.
We talked about earlier. Slowness or dribbling of your urinary stream, hesitancy, frequent urination, feeling like you have to urinate all the time, the need to get up at night to urinate, pain after ejaculation or while urinating, urine that looks or smells funny or is a different color. Those are some signs and symptoms of BPH. How do they diagnose? Oh, this is fun. This is fun part. Digital. How do they diagnose? Digital rectal exams, urinary tests, urinary flow tests, blood tests, PSA. That's a specific antigen that is found in when your prostate is enlarged, your PSA is elevated. And then there's a 24-hour voiding diary as well, ways that they can kind of diagnose what's going on.
There was a question. Somebody wanted to know, how would I describe the digital rectal exam? Invasive.
You can come and describe it.
Terrible.
It's not terrible. I don't know because I haven't had to have it, but we're going to get into it now. And the reason I focused on this, guys, is because so many men feel like my nephew right here. And
I wasn't prepared. He snuck up on me. I thought I had a couple more years.
So see, and that's another misconception. So let's talk about it, guys. Digital rectal exam. And the only reason I pointed out this option, like I said, because so many men are like, don't think so. You're not going near that area. So I think it deserves a little bit of discussion, okay? Some doctors don't even really do DREs anymore and they feel like it is dated. However, many doctors feel that it's a quick and easy way to see what's going on and assess your prostate. Although it's not definitive, it's a good way. And because the reason that is because when doctors use their fingers, go into your rectum and feel your prostate. They feel it. It should be smooth when they feel it. And I'm about to show you a picture where the
wait a minute, because you're not on camera right now. They need to see how many fingers you because obviously you hadn't done. Let me see what they feel. Not 2.
4, Ray? 3?
No.
Oh, it's what?
1.
Okay. Excuse me. I stand corrected. Oh my God. So 1 finger they use, and they do that because, as you can see, this next picture I'm about to show you is the prostate sits in proximity to the rectum. So it's very easy to feel from there. So it should have a smooth texture, but if it has a bumpy texture, that alerts them to something else, and they can feel that through the DRE. Okay, so let me show you what I'm talking about. So I want you. This is important. This is important because I want you to see what's happening. This is why you feel violated. This right here, but you're not really violated. I promise. They're doing this for a reason, and I'm all about knowing gives you power, right? The more you know, the better off you are. You can understand more. That's what Tysons Storehouse is all about. Trying to make sure we all understand why things happen. We may be more prone to act right if we know. Okay, so with the digital exam, the digital rectal exam, the physician inserts the finger into the rectum. Now, if you can see the tip of his finger, you can see where he's pressing. What he's pressing is the prostate. Ray is rocking. He is rocking like Sophia off Color Purple.
Bad memories.
Anyway, y'all forgive me. I'm sorry, my nose is really stuffing up for some reason. But so this is why doctors prefer to do a digital rectal exam. It really is telling of a lot of things for your prostate. So they can feel that because it's right there. And it's quick, whether you guys think so or not. It doesn't last long. Nobody's playing in your area. It's really quick, and they just feel rubbed so you can get the texture, and then they come out. Now, that may help you in being better about going to have your prostate exam or not. But we're just here to inform. I would love to change your mind and make sure that you guys go, because it's so, so important. This is my soapbox moment. Go talk about it to your doctor. Say, hey, I got some family history. I've been having this, and this. I want to go ahead and see about, doing some type of test, blood test or DRE. Okay.
Blood test. Can I opt for the blood test? All right. In all seriousness, even though I wasn't ready, it was quick. It really was. It was quick.
Come tell the people.
The shock of it was I wasn't expecting it, but it was quick. It was an out. But
that is important because I think, like I said in the earlier part of my webinar, a lot of, I feel like a lot of men's health is not given the focus like women's health. So guys, especially you have a man doctor, man to man, I imagine they're like, suck it up, I'm about to do this, but they don't really talk to you guys about what they're going to do and when they're going to do it. So they just, and that's one reason. The second reason I think is because it's so quick, and doctors know how men feel about that they feel like they'll kind of talk their way through it, or, hey, you watched the game last night, and then it's done. But a lot of guys, they don't like that because I wasn't ready. So,
I wasn't.
Right.
And somebody just talking about, did he hit it and quit it? I hate it here.
So yes. So I agree. They should warn you guys, and hey, this is what I'm going to do. But then, a lot of that you could tense up as well, and then it'll be even more difficult because you can tense up. They can't get a smooth. You follow me. So that's is some of the reason why. Okay, but if you know better, you'll do better. Act right, Ray.
Yeah.
All right, treatment. Medication, minimally invasive surgery, laser therapy, open or robot-assisted prostatectomy. Prostatectomy is just removal of the prostate, if needed.
If you remove the prostate, since during ejaculation the prostate stops urine, does that?
You'll have some leakage.
Okay, so you just leaking. Okay, cool.
Yeah, you'll have yeah. So, but that is for very severe cases. That doesn't always happen. Okay.
What, the removing of the prostate?
Right.
Okay.
All right. So that's the treatments. Let's go to prevention. What can I do at home? You can limit your alcohol, caffeine, and drinks at night before you go to bed. Pee when you first feel the urge to pee. Schedule bathroom visits. That was there, but I mean, I don't know how you schedule a visit, especially with grown people. Got stuff to do. But I guess I would want to focus more on the pee when you first feel the urge. When we get busy and we hold it. Try not to do that. Follow a healthy diet and stay active. Try double voiding. What double voiding is? Void means pee. Okay, so when you go in the bathroom and you pee. Get it, pee, finish your urination, wait for a couple of seconds and try to pee again. Even if it's just a little dribble, that's called double voiding, and that just ensures that the bladder is being empty. You want to limit your decongestants and antihistamines. For some reason, that is linked to enlarged prostate. So you want to do that. Let's talk about prostate cancer. Let's get into that.
Ready?
I'm ready.
What's happening?
So the next and last disorder we'll discuss is prostate cancer. Prostate cancer is the third leading cause of cancer death in American men. The American Cancer Society says about 1 in 7 men will be diagnosed with prostate cancer in his lifetime. It has made a definite mark in our community and affected many lives, but for the purposes of this webinar, like I said, we will focus on disease prevention rather than digging into what it is in order to stay true to the focus group of this discussion, okay? So just to get a foundation and visual of what we're talking about, let's quickly discuss what happens with a diagnosis of prostate cancer. So as you see here, this is a normal prostate. What you're looking at is a cross-section view of from the front of a bladder, urethra, and prostate. That's on my left. On the right is prostate cancer. So you can see the cancer cells have enlarged the prostate and it's squeezing on that urethra. Okay, so those are the tumor cells here.
Gotcha.
So prostate cancer starts when the cells begin to grow out. Can I have some tissue? My eyes are watering. When the cells begin to grow out of control, and cancer can grow out of control in any part of the body, and then spread to other areas of the body. Thank you. There is no confirmed cause of prostate cancer. That's the next slide. No confirmed cause of prostate cancer. However, there are risk factors that have been linked to higher incidences of prostate cancer, such as age, ethnicity, family history, and obesity. There are several other risks being investigated, such as inflammation of the prostate, chemical exposures, and sexually transmitted infections. None have been confirmed, but they are being looked into as other possible risk factors. Early detection that's still a screening. Early detection involves screening. Screening is testing to find cancer in people before they have symptoms. So if you likely catch it early, it'll be easier to treat. So prostate cancer can be found early by testing for the prostate-specific antigen. That's what we talked about earlier in your blood. PSA PSA, is a substance produced in your prostate. Elevated PSA levels can be due to enlarged prostate, recent procedures, infection, surgery, or prostate cancer. Another way to find prostate cancer is a digital rectal exam, which we have already discussed. If the results of either test are abnormal, further test is necessary. Do you want to talk to the people? I need to blow my nose. Like I can't even talk no more. Guys, I'm so super sorry. I'm gonna go step out for just a minute and blow my nose, and I'll come right back. All right, sorry guys. So I'm back. Okay. So that's the PSA levels in early detection. So let's talk about screening. What the experts say, the American Cancer Society recommends that men have a chance to make an informed decision. They should know about the risk and everything about getting screened before they get screened. So, with breast cancer, there's a screening for that. There's like parameters around it. I think every couple of years or so we have to get, or every year we have to, after a certain age, we have to get breast exams. Not so with the prostate. So that involves a discussion with your doctor after a certain age. So after you get all the information about the uncertainties and risk and potential benefits, that's when the decision should be made. Men should not be screened unless they have received this information. I think I need to turn the fan off too. That's what's making me stuffy. Thank you. All right, so unless you have this information and all that it entails, you should not be screened. So when should you talk to somebody? This next one. When should you talk to somebody? So if you're 40 and you have a family history, that's when you should have that discussion.
See, this is how he got me. Because I ain't 40.
If you wait to the next one.
Okay.
If you're African American, if you're 45, and you're not 45, but if you're African American, you should definitely have the talk. And they're noticing, I think they're looking into doing something with that age and bringing it down for African Americans because we're so prone to this type of cancer for some reason. So that's probably why he wanted to go ahead and violate you and go ahead and do that because you're approaching 40 and you want to just make sure you're good. If you're 50, you have no family history or not African American, you still need to discuss with your doctor. There may not be anything you need to do, but it may be something you're concerned about. And overall, you need to be having a discussion with your physician. If you're over 70, screening is not recommended.
Why is that?
Screening is not recommended after 70 because of their more limited time span. These men are less likely to benefit from early detection of low-risk cancer. One reason is that there be simply less time for the condition to become life-threatening in most men. Because remember I told you, the prostate, it enlarges and all that stuff very slowly over time. So if they do find out anything over 70, treatment and things like that would just be more devastating than the cancer itself. So they don't recommend getting screened after 70. So why is screening risky? It's just a blood test. Why is it, or a digital exam? Why is it risky? So it's risky because elevated PSA levels can have other causes. Just because your PSA is elevated doesn't mean that you have prostate cancer. It can be elevated for any other reason, for a lot of other reasons. So it's possible to have what's known as a false negative, a test result that incorrectly indicates that you don't have prostate cancer when you do, or it could be a false positive where you don't have it, but it's showing that you do. So a lot of that brings anxiety, confusion.
Is that the blood test that could do that? So you telling me
it's common
that the digital is still the best?
It's not definitive, but it does let them, it alerts them to other things. It's that, they can actually feel with the digital. They can feel bumps or lumps or rough texture of the prostate, which is not normal. They can actually feel that abnormality where the levels in the blood test are just elevated, which could be for 5, 6 other reasons. So this is why they don't do definitive screening. I just wanted to put that out there, okay? All right, next slide. Prevention. There's no proven prostate cancer prevention strategy. Make healthy choices such as exercise, eating, healthy diet, as Dr. Bess mentioned, and talk with your doctor. Be sure that you're talking with your doctor, guys, letting them know, hey, this is how I'm feeling, this is what I found, because you'll be very surprised at what you and your doctor conclusion you can come to when you work together. But if you don't say anything, they don't know, okay? And if you notice, I want to point something out too. I don't know if Dr. Bess is still there, but it's not funny, but it's so telling to me that most prevention strategies always involve diet and exercise. You notice that? Like prevention for prostate cancer, BPH, ED, things we talked about, some things we talked about in the previous webinars, always comes back to diet and exercise. So that's really telling to let us know how important it is to take care of our bodies and watch what we put in it, things like that. All right. Any questions, comments, or concerns? That was fun, guys. I thought y'all were going to really hit me with more stuff.
We're scared.
I see. Y'all still, you're holding back, but it's okay.
No, we're scared because
the penis is just another organ. It's
a tool. It's a pipe. It's a wiggle wagger. So question. I do have a question. Why are some people showers and others are growers?
Some people are showers and others are growers. We don't really we don't really know why that is. But remember, I don't know if you've been watching my knowledge nuggets. Half the size of your penis is in your body. So some people some men have small penises and they grow to over half their size when they become erect. And then some guys with larger penises, they don't extend that much. So it just depends. Like I said, all penises are different. So, you don't know. You get what you get.
Ooh. You can't go out and buy.
I mean, it's some stuff you can do.
Okay.
But I'll leave that up to you and what's your taste.
All right. So last time we talked about Kegel exercises. Are there male Kegel exercises?
As I talked about in my nugget earlier, penises do need exercise, and the way they exercise is having an erection. So men should have regular erections. That doesn't mean masturbation. It just means making sure that you're having some type of blood flow going on. And
I was wondering where you were going with that.
And like I said in my knowledge nugget today, your brain, another way that God thinks of everything, your brain takes care of that for you. So if you have a normal functioning penis with no conditions or health things going on with you, you have erections during the night. You just don't know. So during REM sleep, that's the deepest part of your sleep, you have erections. to work out your penis and make sure it's staying healthy with a healthy tone.
So, okay. So the late DMX.
Lots of sex is good.
Woo.
I just said it.
Okay.
You see how I just put it
yeah,
out
you
there?
just threw it out there.
I just put it out.
Okay. Pull the pin and threw it. Okay.
It's good for everybody. Everybody involved. Yeah.
Okay.
Any other questions?
No.
Concerns?
No.
Okay, guys. Well, I want to go to our last slide, and that's just to let you know, Tysons Storehouse Education Center. We educate, we equip, we empower the community. You must go to our website. You will see there's so many areas that the foundation focuses on. Ex-offenders, review for school. We have the Title I schools, the Health Hub, of course, and all kind of things that we can just, that you can go to the website and you can see. If you want to be a part of anything, please reach out. Please follow us and keep up with us. We'll be doing lots of things, trying to educate the community. So thank you so much for joining us. Don't forget to meet me for the next webinar. I will be putting it out, posting it. I had it here, I don't remember where it is. But I'll be putting it out, posting it the next day. You don't want to miss it. So this month, well, coming up July, be looking for it. Thank you guys so much. Have a great rest of your day. And I will see you soon. Bye.